Welcome to Candid Conversation Season 3. My name is Mwangi Chege. Here at Candid Conversation is where we enlighten minds, inspire people, and enrich lives. And with me is Dr. Elizabeth Njani. Karibu sana Daktari. Kindly introduce yourself and tell us more about you.
Thank you so much, Mr. Chege. My name is Dr. Elizabeth Njani. I am a clinical psychologist and I have specialized in the issues of mental health management. I work at Safe Care Haven, where we take care of all mental health issues, starting with the medical management, that is diagnosis, treatment, and aftercare management of the patients with mental health issues. We also do rehabilitation for persons with alcohol and drug abuse, and also other challenges that may impact the life of an individual, focusing on mental health. So
Awesome.
That's what we do.
Awesome. So, Dr. We want to discuss issues mental health, but we will take a bit of a tangent because the question is: how do children handle mental health issues? And so, in this show, we will be talking about mental health in children. And so, Dr. Tell us a little more about. Are children affected? How do they go about mental health issues?
Well, mental health issues, at times we assume they just affect the adults. And we ignore the children because we think children are very young to get mental health issues, or they are quite resilient, they can cope very easily. Unfortunately, mental health issues is like what we call a cross-cutting issue because it affects all people, irrespective of age, gender, social status, and even their economic background. And you'll find that mental health challenges in children are more complicated than in adults. One of the issues that we have been able to talk about is what does it mean to have mental health issue? And we say that mental health is all about your thoughts, your feelings, and your behavior. Because even in normal life, you find that your behavior is influenced by your thoughts and your feelings. So these three are a major issue, and when we are doing diagnosis and assessment, we must assess those three.
Awesome. Okay.
And when we come to children, we find that there are so many factors that lead to children's mental health. And these factors range from individual factors to biological to environmental. And when we look at the biological ones, we are talking about a child born with a condition. And this condition leads to mental health. We are also talking about an individual with his or her traits and characteristics. And you'll find that individuals are different, even their temperament, and these can be either risk factors or protective factors in relation to mental health. When we look at the individual's environment, this is where the major challenge is for our children. And one of them is right within where the child is born. How is that environment? Is it conducive for the growth of this individual? And we are talking about growth, physical, and then maturity. You find that a child born in an environment that is not conducive starts with the mental health issues right away. And incidentally, it starts when the child is in the womb.
Okay.
Because we are talking about the mother's emotions affecting the fetus. And that's why you hear people saying, this child was born an angry child.
So what you're saying, Dr. is that actually when we are talking about mental health in children, we are focusing right from pregnancy
Yes.
to almost 18 years?
Yes.
Okay.
Because this is where the mothers, when they go for this prenatal care, they are asked about their nutrition, their emotional status, and their physical well-being. because it affects the fetus significantly. There is the issue before birth, and there is during birth, and there is after birth. And what we talk about is the mother taking good care of herself during the pregnancy period, and more so the last trimester, because it is very, very crucial. During birth, that is what we call the perinatal.
Yes.
That particular period is very crucial because if the mother is depressed, depresses the fetus.
And the fetus can actually
Yes.
have all the feel all the feelings
Yes,
of,
yes,
of,
yes,
of
yes.
stress and depression.
Completely.
Wow.
Then the birth process also, like what we talk about the prolonged labor.
Yes.
It causes other problems for this child because the child may be depressed as a process, or does not get enough oxygen and therefore develops other conditions, because if you don't get enough air or oxygen in the brain, it affects the cells. And the moment these cells are affected, you get other conditions. And this is where we get a condition like cerebral palsy. So at the end of the day, we are talking about the mother's physical, emotional well-being. The other one is also the mother's mental health status. It also affects the child because when we are talking about mental health conditions, we want to look at a sick person who is not able to take care of herself. She is not able to take care of unborn and the newborn. So again, you find that that environment is very harsh for this young one. Then, in which environment are you brought in? Look at what has happened this COVID-19 period. People are not stable economically, socially, emotionally. And then a newborn is brought into the same environment. It also affects this child. And what we are saying is we want to look at the child holistically. So we say that for children, when you take them to the hospital and the pediatrician is assessing or screening this child, it should be done holistically. Because at the end of the day, you can tell a child who has mental health issues. And when we talk about mental health issues, what are we talking about? We are starting with the normal stress. And we say that there is stress that is necessary.
Yes.
The stress that motivates you to do something. We call it eustress. It is positive.
So that's
it is
positive.
helping. It is helping you. Like now I know you came under the duress due to traffic. You were late, so you wanted to rush. That the police officer is on the road. You don't want to get caught as you are speeding. But there is something motivating you so that you can go and meet your daily goal. So that is positive, and it is very normal.
So even like when on a day to day, when people say, hey, I'm stressed, akidogo, sometimes it's positive as long as there's a positive motivation pushing them.
Incidentally, when we are talking about being stressed, people don't know which one they are talking about.
Oh, okay.
So many times you find that instead of calling it the right name, we use stress to mean the negative, because we have the eustress and the distress. The eustress is the positive one. Like you find students who are under pressure to revise,
yes,
so that they pass an exam.
Yeah.
That stress is positive.
Okay.
You are working towards achieving a certain goal in your organization. That is positive stress. But the negative one, we call it distress. And this is what we are addressing today.
Okay.
Because we say that stress or distress is a body's reaction to the demands of life. For example, this child is wet or is hungry. This is distress. And she cries, seeking mother's attention. If this child is ignored, she internalizes that the world is not as a conducive or a safe place. So the child grows knowing, I cannot trust this world. I cannot trust anybody around me because they don't respond to their cries when they are in need. So again, we are saying, when your body reacts in a certain way, how do you handle it? And that's why you find that right now our children are in school but under pressure. curriculum for 3 months is being covered within 2 months. So the teacher is under pressure, the child is under pressure, the parent is under pressure. But you find that the parent and the teacher, they will put their pressure on this child to perform. We are asking ourselves, is the child age appropriate to even cope with that pressure? Because we have to balance the play, the rest, and the academics. But we are not giving them that break. And that's why you find that today we are having more children seeking professional help than before.
Wow.
So when we talk about stress, that is one issue about mental health. What happens is that it runs for a period of time and we develop coping mechanism. So if it is the child, they will throw tantrums. They learn to scream and yell. If it is not addressed for a period of time, it becomes their way of life. And they will be reacting in that way. And therefore we say maladaptive coping method. And that needs to be addressed so that it doesn't become part of their life.
Wow. So if that prolongs, then it becomes part of their life, and all they will know is they have to throw tantrum for things to
Yes.
happen.
Yes.
So what I hear you say, Doc, is when a child is in the womb, so to say, how the mother takes care of herself is important.
Very, very important.
So if they are depressed, they pass that. If they are happy and everything is going well, then the child feels more secure.
Very.
Yeah, and so it's important for mothers out there to know that, and for the fathers too. I believe they have a place because they have to treat the mothers right for the child to feel secure. But let's talk about school. Because I think that is where most parents focus on. Like you have said, the parent is under pressure, the child is under pressure, the teachers are under pressure, the government is under pressure. So when all these pressures are pushed towards our children, and especially, like we are saying, we are tackling 18 and below.
Yes.
So what happens, and then what do we need to do?
We need to look at the environment because, as I said, most of the stressors are within the child's environment. And the child's environment, we start with the people around that child. The primary social support. If there is conflict within that environment, it affects the child. And in the environment, I'm talking about the level of poverty is an issue to the child, and we may think that there was this argument where they were saying, the parent provides everything. What would be stressing the child? And we say how you are communicating your support matters a lot. So you become the stressor in the process of providing. You make this child, like if you look at the informal settlements, we make this child to undergo some other level of stress that is not necessary. You make this child a breadwinner. Because this mother tells the children, Mwangi, you are the firstborn, you are the one in charge of rent. This other one is in charge of cabbages. This other one is sugar. All this. And the children must struggle and strive to get their daily requirement. So this child is also under pressure because of the economic status within the environment or within the home. Then you also look at the father's relationship. The parental relationship is also very, very crucial for the child. If there is conflict between the two parents, it means it has a ripple effect on the children. And that is why you also now get the stress now develops into depression, and you get your children who are depressed throughout. They don't want to go to school. They don't want to do anything. They want to keep to themselves. These are some of the indicators. And you can tell something is not right even with the children. In school, the teacher will know because the performance goes down. The child was very good in sports, is no longer interested. And therefore, at the end of the day, we are looking for other issues in this child? Could this child be doing drugs? Could this child be abused? But the key problem here is depression. The other one, you find that children tend to get into conduct issues. They have conduct issues. They are of any kind. In school, they are the ones who are leading the strikes. They are the ones who are organizing this. They are the ones in conflict with administration, in conflict with the others. This is an indicator of child's mental health, and it is something that needed to be taken care of. And what we are saying is, if we are able to look at the child's environment and understand our children from when they are young, we can be able to tell, are our children okay? Because whatever we do has a message to the child. And I want us to go back to the first restrictions that we received, the time the schools were closed. Our children used to say, we have closed school, those young ones.
Yes.
The ones in the middle, it is like it was a half term, and they were very happy they are not going to school. The others were like, okay, this is a stress. We need to go and complete our syllabus and go on. And if you remember, the teachers took it to themselves to ensure that there is online learning for a period of time. Then they gave up in the process. But two things happened that time. The child's social setting is cut off because they are left at home alone. In the hands of nobody for those parents who were going to work. Then there were these who were at home with their parents because the parents were working from home. The parents did not know what to do with this child or how to handle this child because now the child has moved from home to a school where there is structure, back home where there is no structure. The first month was okay, but the second month, the parents drew in the towel. The children were left to themselves, and that is where they started experimenting in other behaviors that were not necessary or called for. Then, in the process of it all, the teachers now want children to get into online classes. Those whose parents were working, there was nobody to supervise. Even the parents who were at home supervising, they were not conversant with the online learning. So it was a total mess for everybody. The child is already stressed, and you add another one. You compound the situation. And this is where we had children with serious medical issues, always in the hospital. Why? Because it is not working for them. So that is pressure that was put on the child to perform and to ensure that we cover the syllabus. The other one is the parents' mental health. How were the parents affected? Because the impact on the parent also had a ripple effect on the children. And this is where we found parents who are working at home and they wanted the children to also do some work, yet they did not know what to do. It stressed the parents. So who was the recipient of this stress? Quarrels with the conflict with the children. Because the parent is not able to take care of herself. She cannot take care of the other person. And the research has proved that children brought up by a depressed parent also get depressed. And the latest one indicated that it was done in a medical setting and targeting the mothers because they are caregivers, that 40% of the children brought up by depressed parents also had depression.
Wow, it's amazing when I hear you talking about this. A few things makes a lot of sense. Sometime back, I realized that there's a certain age group of children that I would see on Gong Road, actually at the traffic lights begging, and they were not there just for a long time. But then all of a sudden, there were many children begging, and it's because schools were closed. Yeah, I also just remember the way parents were online everywhere saying now they know the importance of teachers and how they respect teachers all of a sudden because parents tried to be teachers and they could not. We will take a short break, and then when we come back, we will be handling how to manage mental health in children, and just turning all these things and looking at it positively. So when we come back, we will be talking on how to manage stress in children. Welcome back to Candid Conversations with Mwangi Chege. We are here with Dr. Elizabeth, hanging out at this lovely place, Hotel Troy on Magadi Road. And we are tackling the topic, mental health in children. And we have learned quite a number of things that, mental health in children starts right from conception. So the mothers need to take care of themselves, because a depressed mother actually causes stress on the child while still in the womb. And then as they grow up, they need a safe environment where they feel secure. But Dr. Tell us more about the other causes of stress in children.
Again, we are going to look at the causes within the environment. And one of the greatest causes is the parenting styles that we adapt. Because every parenting style comes with its challenges and its advantages. And more so, we talk about the four parenting style: the authoritarian, the authoritative, the permissive, and the neglectful. And all of them have their challenges. And the worst is the authoritarian, the neglectful, because the child suffers more than these others. The best is the authoritative, because there is order, there is room for discussion, and the children are given room to also take initiative. So your parenting style matters a lot. And this is where we get what we call the toxic parenting. It is all about me as a parent, not about the child. Whatever I do, I am doing for my own gain, not for the gain of the child. Even the school that I take the child, I take that child there by force, by fire, because I want to have
Because it's
a
about
name attached to me. My child went to
XYZ
X national school. My child went to
or
X university.
Or Y Academy.
Or we are doing this group of schools. This is all about them and their status.
Yes.
So again, we need to look at that. We are also talking about the school environment, because there is what we call bullying. The bullying can be physical, which is what you can see, but the teachers are not able to identify the emotional bullying. That is very subtle. For example, when a child is told to get out of the of bed and collect darkness and put in a bottle,
Yes.
that is bullying.
Yes.
Who has ever collected darkness?
I remember
And this child cannot say, because they are threatened with the dire consequences, that if you ever report, if I ever see you near a teacher or a prefect, I'll ensure this and that happens.
Doc, when I went to boarding school, they used to give us a stinking shoe and tell us to make a call to our parents.
Yes.
So that was emotional stress.
That is bullying, and it creates havoc for the child.
Yeah.
The other one is if there is serious illness, like terminal illness within the family, and worse, when there is death, because we ignore children. We never tell them what has happened, because we need to tell children, depending on their developmental stage, based on the language they can understand, that your brother, your sister, your mother has died. this is what it means. You don't tell them, they are just seeing people coming in, they are not part of the whole process. It is quite an issue for the child. So it becomes a traumatizing event for this child. The other one is abuse of any form. The parent out there who are denying their children their rights, that is abuse, negligence.
Yeah.
It can be physical, it can be emotional, it can be economical abuse, and we need to take care of that. These are forms of abuse that affect our children. The one that we ignore most is change of environment.
Yes.
You want to transfer your child because you have decided as the guardian you need to transfer. That is a cause of mental health issue to the child, because you are cutting ties with his social environment. You never prepared him even to help him say goodbye to these friends and prepare him for the new environment. That change of environment is very, very critical for the child. And again, depending on the developmental stage that they are in. And the last one I'm going to mention is the issue of divorce and separation.
Yes, which has
This
become
one
big.
has become an issue, like it is a day-to-day occurrence in our country, and it is affecting the children significantly. So again, when we don't have the court ruling on who has the custody of children, you find that they are moving from where the mother is to where the father is. You don't know what is happening in between, and therefore it becomes an issue. The other one is the kind of peers that these children have, because they are introducing them to substance abuse in their social setting.
Yes.
And they become a key influence to the children. So, as I said earlier, there are so many issues that you can be able to observe and tell that the child is having mental health issues. The first one is, as a parent at home, observe their feeding. Are they feeding as they used to do? Are they eating enough based on their age and their weight? Are they able to, how many times are they eating, and are they reacting to the food that they are eating? The other thing is their sleeping pattern. How is their sleep? Because these are, we call them vegetative functions and we don't leave them out. How are their sleep patterns? Are these children sleeping through the night, through the 8 hours without interruption, like nightmares? Are they also having hallucinations? They can't sleep. Are they afraid of darkness that they were not afraid before? Are they bedwetting and they were not bedwetting before? They had grown out of that. Because these are indicators something is not right in their lives. Again, when they regress to those childish behaviors they had, like bedwetting, sucking, they want to cling onto the parent or to the guardian, these are issues. And therefore, before you even look at their performance, academic and socially, you also need to look at those particular issues that are within.
So
And
these are
also,
signs to just show that something is not right.
yes, something is
They
not
might
right.
not be able to be vocal about it, but then it is up to the parent to try and figure out what the problem is.
Yes.
Okay.
When they go to school, you find that they are no longer interested in the activities that they were very enthusiastic about. Like if it is sports, this person loved hockey, loved football. They no longer have interest. Find out what is in the life of this child. Others, they are sleeping in class. Why would the child be sleeping yet you have enough time to sleep? So again, you look at that. Daydreaming, they are also indicators. So now when we come to management, we are starting with you, the guardian. You need to style up.
So when it comes to mental health in children, like Dr. is saying, it starts with you, the guardian. And we want to find out more about that. Dr. Can you talk to parents, talk to guardians, talk to, those who are in charge of children, and let us know. So what do we need to do to make sure that our children's mental health is taken care of and we have balanced children?
Number one, you have a major role as a guardian to do what we call early identification of mental health challenges. Whether it is stress, depression, conduct issues, alcohol and drug use. Parents tend to get into denial when there is a problem with their children. They will say, not my child. I provide everything. Why would you think my child is using alcohol or drugs? I do everything. Why would you think my child is stressed? My question is, how is the time used? Yes, you are providing everything. You are giving a lot of money. Like this child is in class 7 in a boarding school and you give him 5,000 shillings. What is he going to do with 5,000 shillings in a school for a period of 4 weeks? What are you telling that child? Find other ways of using this money if you don't go for an outing. There are no outing this time because the focus is on covering the syllabus. And when you hear that your child has sneaked out to go and eat from outside, you say the school provides. You are the cause of that problem. So again, how are you balancing? Parents, the way we talk to our children, we need to talk with our children, not to talk to, not to talk at. Because orders and commands, this is not a military camp. It is your, it
But
is
it's
not
my,
a school. It is your
but Doctor,
children.
it's my house.
It is your house, yes. You are not a commander-in-chief. You need
Commander-in-chief of the house of Chege.
Yes, the Chege who is talking. You know, at times we say it shows your insecurity.
Okay.
When you keep asking that young man, who do you think you are? Obviously, he thinks he is your son. He is the one who is wondering what
has happened to
what is
my
your
dad?
problem?
Yes.
Another one will go and ask, who do you think I am? That is a person with insecurity.
Yes.
And you don't go and displace on the children. You deal with your stressors so that you can be able now when you come home to be the person in charge as the commander-in-chief, subtle language. Because your language matters. The what you say, the when you say it, and the how you say it matters. Those three are very, very crucial. Then as parents, we are also saying there are units within the family. There is the husband-wife unit, the father-mother unit, and the mother-children, the father-children. But there is no unit called the husband and children because you are not the husband of the children.
Yes.
You are not the wife of the children.
Yes.
But when you let the boundaries become porous so that the children can get into the husband, wife, and out, it means you are triangulating this child and removing this child Elizabeth to the couple's unit, which is not supposed to happen. And when they learn these things and what goes on inside your bedroom, these children carry your stress and their own stress. So again, management of the units is very, very crucial.
So if we are arguing as husband and wife, the children should not be involved.
Is it possible for you to argue at night and argue it in a diplomatic manner?
Not those ones for utajua mimi ndio kwenye nyumba.
Yes.
You know those ones for African men.
Or you still remain an African man. We know you are in charge and you still remain in charge. You don't need to prove a point to anybody. Respect the children because it affects their development. Remember, domestic violence doesn't have to be just the physical. Emotional is also, because this becomes an emotional issue.
And I think also for the ladies, because it's not only men who are abusive, but I think most ladies sometimes forget and they will shout from the kitchen words that the children, I think, should not be involved when they're talking to their husbands. Is that what you're saying?
For sure, I am addressing both.
Yeah.
The female and the male.
Yes.
You know your style. I know men are more expressive physically.
Yes.
So you want to go hammer. I know these days you are baptizing it. When you are slapping your wife, you are claiming you are giving them the Holy Five. Because the Holy Spirit said it is a slap whether holy or not.
Yes.
And that is physical. Women, we go verbal. We are so good in embarrassing you and asking you, what kind of a man do you think you are? And we are doing it in the presence of children. You are also communicating something to these children. So if you have to sort your issues, you have to learn a diplomatic way of doing it.
Yeah.
Can you wait for the children to go to school? Be left at home. Take a day off. Sort the issues together. or you go to a neutral place and do that, because it affects the children. By the way, if you go to schools and talk to the teacher who handles grade 1, grade 3 downwards, they know you better than you know yourself.
The children go
The
there
children
and
will
say
express
everything.
themselves and say everything that happened, whether positive or negative. That is how they come to know them. So again, you need to look at the children. Even us, as we are doing therapy work, when we tell the children to draw the family, and then we ask them, what is this? They will tell us, and we see you either dressed in a suit, in your pajama, or with nothing. And the moment the children now start painting those pictures, it continues affecting their mental health. Children carry this trauma up to their adulthood. And you are wondering why this lady, Elizabeth, is 20 years, has no male relationship. It is because of what they went through, and they have judged the male gender. And they don't want to be associated with them, they don't want to relate with them, and this is an issue. So early identification is the role of the parent. Clean your house and clean it at the right time. When there is an issue in the family, sickness or death, please involve the children. Let them be part and parcel. Let them learn to say goodbye. I don't know whether you found this clip in the social media where these two small children, a boy and a girl, asked where their grandmother went, and they were told, we buried her there. She went to Jesus. So what these children did is to get pieces of steak, and they went digging, and they waited there for their granny to come back the way he comes back every other time she has gone. Because the issue is she has gone to Jesus. So to them, Jesus is supposed to be in heaven, but grandmother's Jesus is down. That is why he is covered. So how will she come out? They want to remove the soil.
Yes.
So we need to use a language that they can understand to be able to connect, and for them to say goodbye and have that termination. Involve the children. The other one is
and I think that is very important, especially in this season where we are dealing with sickness and death. A lot of death, more than we, I think, before. That the era of COVID-19 and death has become a reality. And so parents out there, guardians out there, kindly involve children. All right.
Yes. The other one is the how you do it. Because when there is an issue within the family, parents tend to disengage and leave the responsibility of doing that to the teachers. For example, your child is using drugs. You want the teachers to handle. The teacher is as blank as this parent. So what do you expect the teacher to do? So here we are talking about collaboration. You work the two together so that you can seek help. And the best that you can do, if you find that your child, the behavior has changed, the child is withdrawn, there is no medical issue, you need to do two things. One, you need to seek a professional, mental health professional. And here we are talking about the psychotherapist or the counselor. We are talking about a doctor, medical practitioner, because they are the only ones who can diagnose issues like depression, anxiety. They can diagnose attention, hyperactive deficit disorders. They can identify, diagnose conduct disorders. Not just anybody. We don't want to say that the clergy has no role. They have a role in conducting prayers. But when you cover everything with the prayer, it means we are ignoring the other side, because we say bio, psycho, social, spiritual. Bio is medical, psycho is the psychological and all the other things. Social is assessing what is happening within the social setting, and then the spiritual, where the clergy can come in. But you'll find that these others are the major, then they cause the spiritual vacuum.
And then we handle it the other way. So especially the Christian families.
Yes.
So they jump all this and they just talk about spiritual, where they say, let's pray about it.
Yes.
And we ignore all this.
It is a sign of denial.
So
it is a sign of denial.
So let's pray about
Wake
it.
up and face the reality.
So let's pray about it
also
as a sign of denial.
Yes. Why aren't you ready for this child to go and be done assessment? That is where the denial comes in. Yes, you can pray, but please tomorrow take this child for assessment by the professionals.
Yes.
One of them did that, and they don't want anybody to know the child is using drugs. So what the mother would do is, if the son demands money, she would give for today and for tomorrow, so that we are not having conflict. So the child has the money for today and tomorrow. This day they were praising and worshiping in the church. The young man committed suicide in the house. And for a long period of time, the teachers had raised this issue. The other one is where parents think that the teachers are against your child. The child you are called in school and you are told, okay, take this child for assessment. We think he has a problem. You take the child and you sit with the child. You bring the child to Elizabeth today in the morning, and you are taking the child back in the afternoon. And I do my assessment, see that this child is depressed. I give you feedback. You say the child has to go to school to prepare for exam. Supposing he dies before he does the exam,
you've lost everything.
You have lost everything, and that child's blood is on your head.
Yes.
Because you didn't take responsibility. So after identification, you need to take this child for professional help and be part and parcel of that help, because the rule is, and this is the professional direction, there is no way I can work with a child 18 years and below and the parent not come in for the same. It is mandatory because you are the one with the child most of the times.
Yes.
And whatever we do with the child, it is you who will also monitor and help the child to implement. So we become partners in the process of working. So again, what we are saying is there is help for children with mental health issues. The only challenging issue is we don't have a hospital that admits children with mental health challenges. By the age of 8, you can be given medication and you do home-based care. They don't admit them.
Okay.
Unless it is severe, and after a period of time, they are discharged to the home-based care, where you take responsibility as a child. When students use drugs, we don't have rehabilitation for children. Again, you are managing it from home. So the burden is again on the parents. So can we become partners quite early?
Yes.
Bring your children for assessment. We shall give you the direction to follow or to use. Take the child to the hospital. The doctor will give you the direction to follow. But when we ignore, they develop to other things. And we've been handling them. And there are so many. Depression, anxiety, these are the major among the children. And therefore, when we assess, we are asking ourselves, how do we help the home environment to be conducive? We need the partnership of the guardian, of the parents. When it comes to school, like I have made it my responsibility, if I find there is a serious issue in that school, I also try to liaise with the school so that I tell them, you can look at ABC to ensure that the school is a bit conducive for the children. So again, because the school rule says, the policy says, you don't expel any child. Transition, 100% transition. For any conduct, there is a new policy by the Ministry of Education. You cannot suspend or expel a child. But you must have structures within the school where this child can be assessed. The other one, and I would like to say it, is where we are thinking that drug toxicology is a solution. Testing the children for drug use is not an indicator that you have handled the mental health. It is just one of the steps that are taken. After you realize that the child is using cannabis or marijuana or alcohol, what steps are you taking? You don't use it for punitive measures. You use it for professional intervention. And therefore, when we look at the mental health among children, you find that it is a major impact because it also impacts the other members of the family. Yes.
There we have it, folks. We have been talking to Dr. Elizabeth on mental health in children. And you, the guardian out there, the work is in your hands. Let us do what we need to do so that we have healthy children who will transition to be mentally healthy adults. And by doing that, we will have a great and healthy society. This has been your host, Mwangi Chege, here at Candid Conversation, where we inspire minds and enlighten minds, inspire people, and enrich lives. Daktari, towards the end, as we finish, kindly could you let the people know where to find you, and even your contact, social media platform, and things like that. Where do we get help?
If you cannot reach us, you can always reach out to anybody else. But as we are at Safe Care Haven, this is a treatment facility along Kiambu Road. We deal with all issues of mental health, starting with the medical, because we have our clinics, medical clinics, psychiatric clinics on Saturdays, and you'll be seen by a psychiatrist. You only need to book. And our number is 0715 527629. We do psychotherapy starting with children to adult, related to all matters of life, psychosocial and medical. You are welcome.
Asante sana.